morning. First, please like and share. Today, we should be able to do that. Please like and share. And today we are back again. This is the 5th week of our coronavirus updates, myself and Dr. Kelly. And this week, some very alarming numbers came out that a lot of people had issue with. And so we're going to talk about that. We will talk about some of the horrible myths that are out there that make no sense. And please listen to us and listen to other people that know what they're talking about versus putting your family at risk. But welcome this morning, Dr. Kelly.
Thank you for having me again, Dr. Renee. This is week 5. Can you imagine?
No, I can't. And then I heard that Michigan extended it, and I'm like, oh, Lord, what did they extend it to? I don't even want to know. I just don't want to know.
I was supposed to go to a conference in DC in May for endocrinology, and I got my refund yesterday. So things are still being canceled. I think crop over in Barbados, which was going to be in August, I believe that's probably postponed or canceled too.
Well, you know, they already canceled Caravana.
Yeah.
Which is the same time as crop over, same time as Antigua Carnival. But Atlanta Carnival has not been canceled, right?
No, I know of.
Okay. So what are the numbers today?
So I went to the CDC website like literally a couple minutes ago, and currently there are 427,460 cases, and so far 14,696 deaths.
Wow. So the big news this week was that the largest percentage of the people dying are Black people. Mm-hmm. Now, there are exact reasons to that. They're not making this up. This isn't some, wild, thing. No, this is serious. There is a reason. And the reasoning is, unfortunately, we are the largest population of people with certain illnesses. So one of them being hypertension, one of them being obesity, and one of them being Dr. Kelly's thing, which is diabetes. So the thing is that those all three are actually tied together. People tend to have, if you have one, you have the other. If you have the other, you have one. So they're actually all tied together.
Metabolic syndrome. So, hypertension, diabetes, obesity, looking at their waist circumference. People have high cholesterol, sleep apnea. So many different things cluster in the same individual.
Yep. So, it is horrible that those are the illnesses that are causing people such not causing them not to have a good outcome with COVID-19. But these are things that have been around for a long time. If you go to the doctor, because we know that a lot of us unfortunately do not, if you go to the doctor, then they've been telling you that you have high blood pressure. They've been telling you to take the salt out of your food. They've been telling you to lose weight, to exercise. And unfortunately, because these people didn't listen, they were maybe walking around still, able to get around. Maybe they had, maybe they regularly had shortness of breath because of obesity, but they were able to get around, and now they're gone. And these are not necessarily old people either. These are 30, 40, 20-something-year-old people that just happen to have these underlying conditions, which is what those things are. They're underlying conditions or comorbidities. These are all the terms that we use. That is what those are. And it's unfortunate, but I think that, and I know, because obviously I'm a Black person and I live in the city, I know food deserts exist. And I know that it can be very, very difficult to find your groceries, to find a grocery store within, walking distance from your home. But I think that we as a community, if that's going to be the case, then we have to collectively get together and try and build urban farms and go to the grocery store, collectively. If, so many people in the community have cars, and they go to the grocery store and they get fresh fruits and vegetables for us to eat. But we have to somehow take some sort of ownership and be able to take care of ourselves, because let's face it, they have not taken care of us most of our lives. And so what makes you think they will do it now? So therefore, we have to do something ourselves. The other thing I told Dr. Kelly I was going to tell you is, the other thing that's really important is the census. And the census is important because if they don't know that we live there, then they won't put federally funded health clinics and stuff in that neighborhood because they think we're not there. Grocery stores won't show up there because they think there's no one to buy from them. So it's really important. And I know April 1st was the one thing that you heard, and I heard it too. I found out that you actually can go to 2020census.gov right now, fill out the census. They just wanted to know who was living at your residence or where you personally were living as of April 1st. So if you could go and make sure you fill out your census form so that they know that people are in these areas, that will help also, because we know that access to healthcare is insurance and also actually having a place to go.
I think it's, the whole issue is kind of multifactorial. And I'll give you some data actually from Chicago. So in Chicago, I think Blacks make up about 30% of the population.
Yep.
However, 70% of people who died in Chicago were Black. So why is that? Dr. Renee said there's an issue about food deserts. Our genetics don't necessarily predispose us. Genetics alone don't predispose us to the high blood pressure and the diabetes. A lot of it is lifestyles that have been passed down through generations. A lot of it is not having access to healthy options. How many playgrounds and parks to run do you see in the inner city? So where are people going to exercise? One, right? Secondly, there's also a lot of mistrust in the Black community for the medical fraternity. And I think the mistrust is understandable. But initially when this whole coronavirus came out, we were hearing that Black people don't get it. And I think that kind of caused people to not follow the whole social distancing rule initially. People aren't going to their doctors as much as they should because they don't trust us, So we need to fix our bias in healthcare as well. Also, like overcrowding. How can you practice social distancing if you live in a 2-bedroom apartment with 6 or 7 other people? A lot of things we really have to address. I see patients who have diabetes, and I'm not seeing anyone in person anymore, thank God. It's all via, either telephone call or video conference. And there's still some patients, even during a pandemic, where I'm sure they're hearing that diabetics are dying from this. They're still not checking their blood sugars. They're still not taking their insulin like they were prescribed. They're still not eating well. And I'm like, don't you get it? Like, I'm not trying to scare you, but I really am. You need to take better care of your blood sugars. Now is the time to make those dietary changes. Now is the time to start checking your blood sugars. If you're on insulin 3-4 times a day, if you're on tablets, at least 2 times a day, because these comorbidities or coexisting conditions are taking us out.
Exactly. And it's, I'm over here on LinkedIn. Sorry, guys. So it's just terrible. And like I said, at some point we do have to take some ownership. Now, I was telling Dr. Kelly last night, these things aren't going to be fixed overnight. So you change your diet today, you're still going to have hypertension tomorrow, which is probably why it'd be best for you to stay at home, because you still could get struck. And I actually just watched a video, I sent it to Dr. Kelly, of Dame Dash, who was the owner of Rockefeller Records that Jay-Z was on. And he has diabetes. And I believe he actually has type 1 diabetes. And he was talking about how he heard about COVID-19. He heard immediately that people with diabetes, if they got it, would go down quickly. And he said he wasn't ready to turn his lights off. That's what he said. And so he stayed in, and he's been, sheltering in place, and he's been, monitoring his blood sugars and watching his diet and really taking care of himself. Him and his girlfriend are expecting a baby, so I'm sure he wants to make sure that he's here for the baby. But he understands. Take it seriously. And so you don't want. And then last night, Revolt TV did a really great town hall meeting on YouTube. Thank you, Sean P. Diddy Combs. And it was amazing. They had a lot of great people, a lot of hip hop artists, a lot of, they had 2 physicians. One was a psychiatrist. The other one, I forgot what her specialty was, but I know she has a public health degree in addition to, but it was really great. But it talked about how we need to, and I've said this over and over, you don't so much need to worry about yourself as you need to worry about your neighbor, your grandparents, your parents. So if you can, yes, you probably walking around and you're probably just fine and everything's great. You can, you can whistle Dixie, you're fine. But you could still be carrying the virus. And because of that, you need to watch out for those people. So if that means that you can't go visit your mom for this extended period of time, then so be it. But I think you would probably prefer to take this break from visiting her now than never be able to visit her again. And I mean, I know it sounds harsh, but I've heard way too many stories of people who, they went out to maybe a party or whatever, and then they came back and ended up infecting their family. And maybe the whole family didn't die, but somebody did. And maybe the whole family got sick, but someone died. And I think that's just something you don't want on your conscience to say, I just had to go to this party, or I just had to go to whatever the gathering was. Was it a funeral? Was it church service? All of these places, they have documented people getting sick in large numbers and people dying. And so I think, and I am a Christian. I have been an Episcopalian my entire life. Today is Good Friday. Happy Good Friday, Kelly.
Happy Good Friday to you.
Jesus rose again. And, on Sunday is Easter Sunday. But I will have to put on my Easter bonnet right here in this place because I am sheltering in place. And I will have to find a service online. There'll be many. If you're really interested, there'll be many. Find a service online and attend church via online. And if your pastor or priest says some craziness about having service, could you please tell them not to? Because unfortunately, when they do stuff like that, it's usually the elderly in our communities that are going to go, and they're the last ones that need to be leaving the house. The last ones, because their immune systems, just because of their age, is already not as strong as maybe a younger person. And they usually tend to have several underlying conditions. I'm sure you've seen grandma sit there and take all her pills for the day, and your parents, and they go to all these doctor's appointments. So just know that they probably are the ones that would get it, and they probably won't have a good outcome. So please, don't think about yourself so much. Think about other people.
Certainly. And, I wanted us to talk about some of the myths that people have. Like I heard up to this morning that, if you can hold your breath for 10 seconds, you can't get coronavirus. That's false. Actually, WHO, the World Health Organization, has a page called WHO Mythbusters. They have a whole page dedicated to some of the stupidness that we hear about coronavirus. So no, holding your breath, it doesn't mean that you are that you don't have coronavirus. The only way to know if you have coronavirus or not, unfortunately, is to get a test, because some of us are asymptomatic, not having any symptoms at all, and we're still able to spread it. Another one that I hear quite a bit is about blow drying your nose. That also does not kill coronavirus at all. And in fact, if you apply too much heat, the mucosa in the nose is very, it's kind of thin. So that's why when we rub our nose too much or whatever, it can bleed, right? So you don't want to apply air from a blow dryer into your nose. You're going to make yourself even more susceptible to having viruses. What have you heard, Dr. Renee? A lot of the myths that you've heard.
What have I heard?
The 5G.
The 5G. Here's the graphic on the 5G. So viruses cannot travel on radio waves, mobile networks. COVID-19 is spreading in many countries that do not have 5G, which would tell you that this is a myth. So this is one of the biggest ones that I've heard most recently. People won't stop talking about 5G and this, and it causes this. And if it causes that, do yourself a favor. Don't upgrade your phone to 5G and be done with it. Simple as that. I'm fine with my 3G. I don't know about you, but I'm fine with my 3G. But you know what I'm saying? Like, the problem is that, Kelly, and I know you know, the problem is that people, the wrong person, will hear these myths and think they are truths.
And share them 500 times.
And maybe 500 people won't believe it. But even if one person believes it and they become a fatality because of something they did or did not do because they believe that, that's just horrible. That is just horrible. I read earlier this week there was a rabbi, I want to say he was in New York, but don't quote me. And he said that this whole illness was because of, he sounded like HIV/AIDS. He said it was because of homosexuality. Okay, so it's not funny, but guess who's COVID-19 positive?
The rabbi. I saw that on the news.
Yeah.
What about garlic? I've heard.
Oh my God, garlic.
I've heard that garlic. So
I should have got that one.
So I'm reading it here. It said garlic is a healthy food that might have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. So a lot of these things like garlic and what else do people eat?
Lower blood pressure.
So garlic and the oranges and all that stuff. I mean, it's good. Zinc, they're all good. They help to boost your immune system. So I'm not saying don't eat your garlic. I'm just saying don't have that false sense of protection that because you eat garlic,
you don't have to take the medicines that Dr. Kelly prescribed.
Yes. No. No. So this page is actually pretty cool. WHO, just Google WHO Mythbusters.
And it's just a whole bunch of infographics, and you actually can download them and share them. So definitely go check those out. And this is the World Health Organization. So they are the ones, we've said the World Health Organization and the Center for Disease Control are the two places that you would want to get your information. And so that's the World Health Organization. And they're just trying to get the information out there because, like we said, it only takes a few people to spread the wrong information, and one of those people end up doing it. You know, there was the number 45 said something about some drugs, and then a couple did it. They took whatever the drug was, and now the husband is dead and the wife is sick. Remember, take your information from physicians. He might be number 45, but he is not a doctor. Here's my social distancing picture, just to remind you all of how important it is to social distance. So I see, sees 5 people, and look, in 30 days, sees 1, 2, 3 people, and in 30 days, look how many people they've infected. So one person sees 2 people in 5 days. We've reduced it. And then if one person only sees 1 person in 5 days, look, we only have 3 people infected in 30 days. So I think that we all should keep with the social distancing because it is working. I know Chicago has bent the curve, so I think we're on our way. And unfortunately, other places haven't got there yet, but we're on our way. Even other parts of the world are on the other side of the curve already. So they're flattening the curve. So we want to get to that place, and we want to get there sooner rather than later so we all can go about our lives in our new normal. But we at least can leave our homes. So, I don't know. A lot of people may never hug anyone again, but
Dr. Fauci was saying yesterday that you should never shake somebody's hand ever again. I think we did a lot of things that we took for granted, like, shaking someone's hand or, opening a door with our hand without thinking about wearing gloves or flipping a light switch on. Those things that we did without even thinking. How is life going to look? What is life going to look like after this? When are we going to get back on a plane and feel comfortable traveling somewhere? When our country's border is going to be opened up for other people to come in and out? I don't know.
It'll be very interesting.
Mm-hmm.
It'll be very interesting. But yes, everyone, please, if you just make sure if you have any other questions, please let us know. But this is week 5, and I don't see the end quite in sight yet, but I know that if we really, really, really ask us to do, which is to stay home and 6-foot distancing when you do have to go out, I think that we can, we can end this much sooner rather than later. I know that here in Chicago, there's a huge house picnic July 4th. And right now they're still not postponing because they're really hoping that we'll be on the other side of this by then. People travel far and wide for this picnic, so it is a really big deal. But Essence Festival, that is 4th of July weekend, has already been postponed to the end of the summer. So there's been a lot of changes. And I think that, if you think about how much faster we could get out of the house if we all listened to what's going on, and if you know somebody that's about to do something crazy, then just tell them, hey, let's just stay home. Somebody said last night on the town hall meeting that they were their friend hit him up and was like, yeah, what are you getting into? He said, home, the crib. I'm like, exactly. So if you have to encourage other people to stay home, please do. There was a video that was live streamed this week from Chicago, and it was a full court basketball game.
I saw that.
So clearly, none of them had the good sense to know that they didn't need to be out there because, you have to have a certain number of people to be able to play. So if even one said, hey, and then they got another one, so let's not all be dumb together. Let's all be smart together because, yeah, they all obviously were very healthy. They ran up and down the court, sweating and touching all over each other, which is just so not appropriate in this situation. But now they're going to go home, and who knows who they're going to interact with when they get home. It's just not a good situation. And please be mindful. I understand that Sunday's Easter, but this is not the year to have the big Sunday Easter dinner. This just isn't it. So if you have to deliver the dinner to grandma's porch, leave it on the porch and let her pick up the dinner after you've left, and you guys get on Zoom or on FaceTime and, say grace and have dinner, that's the new Easter for 2020. But you cannot congregate. If the people in your home are the people in your home, then that's the people in your home, and you cannot invite anybody over for Easter dinner, and you and your family can't go anywhere either. That would be a recipe for disaster. All of the, I guess, progress that we've made with this will be for naught because people will be dropping like flies in the next few weeks because of all of that congregating. I mean, we've seen it. There's been funerals, there's been parties. We've seen it. There's been parties here in Chicago where they said like 16 people got sick, 3 died. So please, this isn't the year for the big dinner. And hey, have a big dinner we celebrate when we get outside of this, but not this year. Leave the dinner on the porch and go on about your business. Thank you for the plate and keep it moving. So I just hope we don't have to hear about any more deaths. I'm sure there will be still some more, but I just hope, I've seen the pictures in New York where they're stacking them up in the refrigerator. It's just awful. And then the fact that these people have to die alone, no family members.
I saw an article stating that DC, Baltimore, and Philly are going to be the next hot spots in the country. So for those of you who are listening to us who live there, the next couple of weeks, you guys really need to do the hand hygiene, the social distancing, the not touching your face. If you have a mask, you should wear it out. If you go into a public area, the mask doesn't protect you per se, but if you are an asymptomatic carrier of COVID-19, it protects other people. So if we all wear a mask when we go out, we're protecting each other.
And there was a picture we saw for DC last weekend at a fisherman's market or something, and it was just a ridiculous number of people, and it was no way they could social distance. So please, stay home. Just stay home. And if you cannot stay home, make sure that you are an essential worker or you are taking an essential trip to the grocery store, to the pharmacy. But even the pharmacies are delivering for free. So there's all sorts of ways. And I promised, and I will do a video and talk about how all the different things that you can actually receive at your doorstep without ever having to come in contact with a human being. And I'm talking about everything can be sent to your home so that you don't have to step outside. But thank you so much, Dr. Kelly. I will see you guys next week.